We're the hidradenitis suppurativas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The hidradenitis suppurativas. Put the shame to a halt, cause it's not your fault.
What's up, you guys? Welcome back to another episode of Hidradenitis SuppuraDivas. We are so excited to be here with you today. I'm here with my right hand on my left side, as you can see if you're watching, with Brinley Brooks, the Executive Director of HS Connect. I'm Sydney, and we are here today. I'm going to let her introduce herself. We're kind of going to talk about just birth control, hormones, how that impacts people who are living with HS. A lot of women seem to see that correlation. So we're excited to dive in deeper today. Would you like to introduce yourself?
Yes, thank you so much, you guys, for having me today. My name is Rachel Masters. I'm a family nurse practitioner. I work in a gynecology office, so I'm treating individuals with vulvas and vaginas that have HS.
Fantastic. It's so good to have you here, and thank you so much for joining us. Um, what do you see as the number one factor that people come in for with their HS? Do you see them coming in mainly for looking for birth control or things like that?
I will be honest, I will get a fair amount of patients that come in with flares um, that are having pain and issues like that. But in preparation for this, I was thinking back. The majority of my patients with HS that I treat don't come in with that as a complaint. They don't even tell me they have HS. And it's not until I do an exam that I noticed this, and I mentioned, I'm like, hey, I noticed that you have this going on. And they say, oh, I just didn't think that it was anything relevant that I needed to bring up to you. It just is what it is. And so that's, prompts me to then have a deeper conversation and talk to them a little bit about what their concerns are, just because they don't, feel like it's something that warrants making an appointment in the first place, which is just devastating.
That's so awesome. I'm glad you're inclusive in that conversation with them as a nurse practitioner, because I think, we all have similar stories to that sentiment of like, we didn't think that it was anything that you would care about, so we're not going to talk to you about it. When we come across the right doctors who ask the right questions, you do care and you do want to find a way to help us. So that's very interesting, and thank you for sharing that with us.
Well, and shout out to all the patients who are still going in to have their annual exams who are dealing with HS and not shameful about that. So that makes me really happy to hear that that's still happening, because I know in our community that's a huge concern, is that people will skip out on regular healthcare and follow-ups because of their HS. So that makes me really happy that they're showing up, and that through that process that you're able to help guide them. What is your first step as far as for patients who come in and didn't know that they had HS, and now they're just learning that this is something that they're dealing with? Well, they know that they've been dealing with it, but now it has a name.
Right. And I think that it's interesting that, I mean, I have patients in their mid to late 20s that I'm like, this is, I start talking to them about, these areas, and they just constantly say, oh, I'm just prone to boils. I'm sure you guys, hear that all the time. And so, we start talking about how this is kind of like a system-wide issue, and that it's inflammatory in nature. And, I have so many people that are embarrassed and say, I just thought it was because I was dirty. And so we have to have that really extensive conversation about, what this disease process is, and that they shouldn't have shame associated with it. I will have a lot of patients that, will be completely covered. I'll walk in and they're not in a gown. They're, still completely clothed. And, I'm never going to say, oh, why aren't, why are you not undressed? But, it's okay, tell me a little bit about, you're still clothed, what the issues are. And they're like, I'm sorry, I have these areas and I'm just too embarrassed to show that. And so it's, then me kind of educating and having that open conversation before they're even comfortable with the concept of a physical exam.
Yeah, it is a very thank you for taking the time to do that and like having those conversations because it is such a shameful condition. And most of us in our prior experiences have been told that it's our fault.
Hmm.
You know, by way of weight or smoking or some other, figment of someone's imagination. Uh,
Absolutely.
so there's a lot of shame that comes with that, obviously, and feeling like I'm gonna go to somebody and they're gonna just tell me the same exact thing, and it's
Right.
really, difficult to deal with, so I'm really appreciate that you handle it that way, and to say, like, "There's no shame here," like,
Yeah.
"This isn't your fault. It's you had nothing to do with this."
Yeah, and it
Yeah.
being the first line kind of of
Yeah.
like defense. That's what we're trying to embed into the doctors or dermatologists or like anybody that we come across is that
Yeah.
we want that to be the first thing that you're telling somebody who you're giving them that diagnosis of, I think you're dealing with hidradenitis suppurativa. But one of the first things I want you to know is like, this isn't your fault. You shouldn't be shameful. And I think the more that we unstigmatize that, the more people are going to naturally want to have those conversations with their doctors. So thank you so much for that. I remember a time in my life where I did have to be on birth control to kind of not only help with my period because it was so heavy and it was so
Mhm.
painful. And then my HS would flare the week before my period because my
Yeah.
hormones are getting crazy. So like it was always just a 2 week storm. And so I'm interested to know if birth control is still a helpful tool that you guys are using for women who are experiencing heavy cycles, and then like hormones are a trigger for them.
Yeah, absolutely. I have a lot of patients that come in and they say, "Oh, you're gynecology, so all you ever want to do is prescribe birth control." And that's our universal fix for everything. And that's obviously not the case, but there's a reason we use it so much and why it's a first line treatment for so many things. And I think that, understanding that the reason we utilize birth control all the varieties is that there does seem to be, and we're not exactly sure the link, but we do know that with the changes of hormones in our menstrual cycle, and what I tell patients is that we and demonstrate to them is we kind of have this like up and down of our hormones, but for some of us our hormone fluctuations are more kind of like this. And when we get those kind of spikes in hormones and then we get that rapid drop in hormone prior to our cycle, we start seeing that, systemic inflammation. It's why, we're having these flares of HS. It's, our body is kind of reacting to these fluctuations in our hormones. And by utilizing a form of birth control in which we're giving you a steady dose of hormone every single day, instead of having these highs and lows, we're telling your ovaries, like, chill out, we've got this, and we're going to have this kind of steady regimen of hormones. Not to say that it completely fixes this, but if we can kind of subdue those changes, we can help kind of control the fluctuations and hopefully help reduce the amount of flares and the issues that you're noticing in that time leading up to your period. I have so many patients that say, I have one good week a month, basically. And because that week and a half leading up to your period where you're kind of getting this, spike and then this drop, if we can kind of level that out, not only are you hopefully not going to be, crying unexpectedly at, commercials that you wouldn't normally cry at, but we're giving our body that chance to just kind of have that stability. And so we're seeing that kind of stabilization not only with hormones, but we're seeing that happen with the lining of our uterus. So we're keeping that lining nice and thin, so when we do have that withdrawal of hormones during those placebo pills, if for example we're using pills, we're the lining that we've built up for our uterus is much thinner. It's our period's going to be shorter. It's going to be lighter. We're going to have less cramping associated with it. And that inflammation that's happening because those hormones were stabilized is going to be drastically improved.
Now, I know PCOS is a common comorbidity for HS, and does birth control help with PCOS as well?
Absolutely. Yeah. So, we have kind of this triad of symptoms for diagnosis purposes of PCOS. And, part of that triad is those elevated androgens, or specifically testosterone in the system. And we know that there is some correlation with testosterone, androgens, and HS. And so by using a birth control that has estrogen in it, generally speaking, we're able to kind of counteract that testosterone a little bit and kind of level things out. With PCOS, we also often see acne, really irregular, heavy periods. If you're going 3-4 months without a period and then you have a period, it's typically pretty awful. So by using those hormones to kind of regulate that, just to regulate your cycle, we're going to be able to see and have a much more tolerable period, in addition to having that control that's going to impact everything else.
And do you ever deal with, I'm sure most of your patients are more adult. But
Right.
do you ever have like teens in that have HS issues? And I know one of the main concerns is like birth control is a great help for a lot of people, but
Mm-hmm.
some parents are so opposed to it because they feel like it's like a green light for their child to become promiscuous, or like,
Absolutely.
okay, we've given you like
Permission to go have
yeah,
sex, but they don't think
exactly.
about the
Right.
long too, because like at least they're being protected
Yeah.
for teen pregnancy.
And it doesn't,
Right.
I mean, there's such a like a misconception about children being on, or
Birth control.
teens, birth control.
Yes. Yeah.
So how do you,
Yeah.
is that something you've dealt with, and how do you handle that?
So I definitely see that.
Hey guys, sorry to interrupt. I just want to talk about something that I think a lot of us in the HS community overlook, which is clinical trials. I know. When you hear clinical trial, your brain probably goes to a lab coat and a clipboard situation. But honestly, it's not like that. Being in a clinical trial is just going to the doctor's office. You're seen by a care team, you have appointments, they're checking in on you. It genuinely feels like some of the best, most attentive medical care you will ever get. And here's what a lot of people don't realize. It's completely covered. You're not paying out of pocket for any of it. And many trials actually help with travel costs too. So getting there isn't on you either. For those of us who've dealt with HS and know how expensive and exhausting this condition can be, that's actually a huge deal. Beyond the personal stuff, every person who enrolls helps us get closer to better treatment options for everyone living with HS, and that matters because we all know how much we need more treatment options. A big thank you to Moon Lake for sponsoring today's episode and for supporting the HS community in a real and meaningful way. We'll drop a link in the show notes if you want to learn more. All right, now back to it.
Part of our practice is urogynecology, so we deal with incontinence, pelvic floor prolapse. So we do have a portion of much older patients, but I do tend to still see a fair amount of teenage patients. It's so amazing to me that people still think, and parents still think, that their children and teens need permission to have sex, because they're doing it. And whether they want to believe it or not, it's happening. And so, I'm trying to, have that conversation with parents of saying, listen, if this is for the purpose of, contraception and pregnancy prevention, there are worse things, like an unplanned and unintended pregnancy. The way I like to broach it with new patients, I walk in and, a 14, 15-year-old sitting at the on the table, clothed, but just sitting there, and, they're terrified. They're looking at me like I have 3 heads. I get to the bottom of what their concern is, but then I like to start saying, instead of birth control, I like to say period control pills. I like to say acne control pills, and give them that explanation of kind of the hormone fluctuations, and how, I always just tell them, like, your ovaries do not know what the hell they're doing until they're in their, sometimes mid-20s. And so we're using these period control pills to kind of regulate that. And so, that's kind of the conversation that I have with my patient. And then I do have parents that often come in. Generally speaking, it's mom. And so then I like to have the conversation with them of like, listen, this is the right thing. You're doing what's best for your child. You are helping them not be miserable for 7 to 10 days a month if it's more so the period that's the concern. And then obviously eventually most people are going to become sexually active, and that's going to already be on board. It's the individuals that don't have that comfortable relationship with their parents to say, hey, this is something that I need. I had a patient not too long ago who brought her 15-year-old daughter in to get an Nexplanon, which is the rod in the arm, and she was devastated. She was crying. She said, I'm such a bad mom. I'm letting my 15-year-old have sex. I brought her in for birth control. And I said, you're doing the one thing that you can do, which is make sure she's protected. You are doing everything you're supposed to do, and making sure that they understand that no matter at what point they're seeking contraception or they're wanting to go talk to somebody about some type of hormonal contraception for whatever the reason, they're doing the right thing because they're getting them to the person that they need to be with to help address the concerns that they're having.
That's good. You're changing the perspective, not only for the child or like the teen who needs it at the
Mm-hmm.
time, because I mean, acne control is like genius. I would go for
Yeah.
that.
Absolutely.
But for even for the parent, because it is a huge thing. If my daughter at 14 was like, "Oh, I'll be on birth control," I'd be like, "Girl, what?" But like,
Right.
because of my own medical history, it's deeper than that.
Right.
But like, it takes it's a moment a parent has to look in the mirror and say, "Am I doing this for the right reasons?" And even if you are a parent who's just simply putting your kid on birth control because you don't want them to be a teen mom or a teen, like,
Right.
there's nothing wrong with that. I think it makes you a better parent for it. We have to release that stigma as well, as like, because you're trying to be proactive, it doesn't mean that you're a bad mom or a bad dad. Especially because I know I've seen serious scenarios of a dad feeling like it was time to put their daughter on birth control because they're a single dad and mom's not around. Like, and it's just not something that they're willing to roll the dice on. So even if you're only using it for, teen pregnancy prevention, I think that that's not a bad thing. So, I have a question though, because I know you said you see kind of like you see teenagers, but you also have a older group of women. So like, say a woman is in her childbearing years and she's on birth control. When's the best time for her to get off of birth control, to start thinking about like experiencing getting pregnant? And how does that conversation usually go for you guys?
Yeah, so I mean, it varies for everybody, and it's going to really depend on the type of birth control that somebody's on. If somebody's on the shot or the Depo-Provera shot, I usually recommend having them go off of it about a year before they're ready to try to conceive, because Depo can stay in your system for 9 up to 9+ months. And can take that long for your cycles to regulate out, as opposed to say like an IUD that, because it works locally in the uterus and it doesn't suppress ovulation, I've had patients, I take their IUD out and within a month they get pregnant. Um, Birth control pills, I typically recommend about 3 months, for that to kind of get out of your system and for your periods to kind of regulate out. And for a lot of these patients, they come in for their annual exams and, ask them how they're doing on birth control, if they have any plans for conception in the near future is kind of the term that I use. And then that then prompts the conversation of, we're wanting to try to conceive in the say next 6 to 12 months. So then we look at the type of birth control that they're on. I always recommend starting a prenatal vitamin prior to going off any type of birth control, just because you don't know, it's possible to get pregnant very quickly after going off of birth control. But what I often find is that, I have patients 25, 26, all the way up to their mid 30s. They've been on birth control since they were 13 because their periods were so bad. They don't know what their body is like without birth control. They don't know what their periods are like without birth control. And so I like to always give that recommendation of a good 3 months, because it can take that long for your body to be like, whoa, okay, we're doing this on our own now. We've got to kind of regulate things. And so, giving it that good 3 months to kind of figure out, what your body is like without some form of intervention or cycle control, and then kind of going from there. And then it's a little bit different because in my office we don't do obstetrics, so we don't do pregnancy monitoring or anything like that. So from there I have the conversation of, these are the OBGYNs that are in our area, this is what you do when you have a positive pregnancy test, and kind of the next steps once they confirm a pregnancy, for them to go to another provider to manage the pregnancy.
That's great. Thank you so much for breaking that down. I know that's going to help so many women out there who, like you said, have been on birth control for a long time.
Yeah.
And now they're just like, I think like I'm ready to become a mom, or they get in that relationship, right? And things just start to change and they wonder what life will look like. So I know, like, as soon as you said that, I know that that's going to help so many women who have that same question. I know we're going to wrap up soon, but just one last question that I have for you, because I know that there's a bunch of people out there who feel this way. Um, so what if hormones are a trigger for you? Your periods freaking suck, but you don't want to be on birth control. What do you tell those women?
It's tough, because I have found that there's a big push, especially on social media, and just across the board, that a lot of people, because they've been on birth control since they were a teen, and they want to see what their body is like without it. I try to always make sure that they understand the why behind birth control, just because it does seem to be this blanket treatment with gynecologists. So I try to, explain to them, because it's startling to me how few providers actually educate their patients, and how so few people, and the women and people with vaginas that I see, have no idea how their body works. They have no idea how birth control works. And after I explain to them what they're doing, how it's being done, they're like, oh, okay, I feel like this is something that I'm okay with proceeding with or continuing with. Not that I ever want someone to feel forced like they have to. I do have a fair amount of people that do go off of hormonal contraception. Unfortunately, there's not a lot of non-hormonal options for period regulation. There's shockingly, there's not a ton of research done into that field. And so we have various over-the-counter supplements that aren't FDA regulated, that are supposed to help with ovarian function, and regulation. From the period side of things, I will often have patients do cycle tracking, and so that way, if they have a consistent period, we can do something called scheduled NSAIDs, or non-steroidal anti-inflammatories, like Motrin, ibuprofen, naproxen, and you can kind of pre-medicate with that a day or two before your period, and that's going to help with the cramping associated with it. It's going to, contrary to popular belief, it's going to actually help with bleeding a little bit. Now, it's, ibuprofen's not a magic pill, but that's one of the non-hormonal
Cramps?
options.
Give me an ibuprofen 800 for them cramps. And
It's,
I
it's
actually had to do that same thing. I had to take ibuprofen 2 days before my period as a teen, because it would be so unbearable. Like, my mom would have to just, these 3 days of your cycle, you're not going to school. Like, it was very challenging. And then I did get to a point where, like, I was like, you know what, I'm kicking this birth control. But like, then I started having all these damn babies. So
all the babies, yeah. And unfortunately, in that period of time, our options are a little bit more limited. And then from the HS side of things, if you're going off of your birth control, you're going off of, say, like the spironolactone that you're on for acne, those things. We're looking more at kind of topical products. We're more just kind of general symptom management from that side. And I'll be honest, that's when I'm often, okay, this has kind of gone a little bit beyond what I'm comfortable with recommending, and that's when I do shift a little bit more towards dermatology, just because they seem to be a little bit more well versed in the topicals and things like that than I am. But I think that there's no right or wrong, but I want to always make sure that the reason behind them not wanting to pursue that is, not just because some influencer told them to, but because they actually understand how it's working in the body. And if that's truly then not what they're wanting to pursue, then we talk about those alternative options.
Empowering the patient.
Yeah.
And that's the best tool that any doctor has. So thank you for keeping that in your tool belt, because when you empower the patient to be educated, or when you educate the patient, they're empowered to make the right decisions about their care wherever they're at.
Absolutely. I mean, I tell people all the time, I'm like, I don't know your body, you know your body. And, you have to tell me, what you're feeling, what you're experiencing. And, we'll try our best to treat what you're dealing with, but sometimes it's a little bit of trial and error. So bear with me, but let me know what you're feeling and we'll try to do what we can to manage it.
Yeah. And I just want to plug, when you were talking about tracking, I just want to plug Papaya, which is an HS app that has been created by two HS experts with the help of HS Connect and some other patient orgs. And you can track your menses on there. You can track all of your HS flares, your periods, your food, your
Medication.
everything. Yeah. So it's a great app, especially for patients with HS, because it was built specifically for us. And then you can go
Oh,
in and send your doctor a report or print out a report for all the time that you've been in there, so that you can look for cycles and changes. And kind of, if you're trying to identify food triggers, if you have any, that's a great way to do it, or exercise or anything like that, to see what your flare cycles look like. So it's a great place for patients to go in and track all of that information in one app, um, to keep track of what's going on, and then be able to articulate that to the provider. So
I love that because I so often have patients that come in and they have little journals and they have, notes on their phone and they're trying to, because, you walk into a provider's office of any type. I mean, even though I don't think I'm, that intimidating, you walk in and you're like, you kind of freeze up and you're like, I don't know what I want to talk about. I can't remember,
Everything's fine.
what's
Everything's
been going
perfect.
on.
I don't remember why I'm here either.
Exactly. It's like, oh, what do I do with my underwear, type of thing. And so it's nice to be able to have that tangible, like, okay, this is why I'm here. I love when patients are like, this is what I've been recording, this is what I've been noticing, and I can just kind of read down through and say, oh, okay, now I not completely understand. I don't think we ever completely understand, but now we can work through what you've been dealing with, and it's, they're able to, like you said, kind of articulate it to us in a little bit of an easier way.
Yeah, yeah. So definitely recommend that one.
Yeah.
It's amazing. You can get it on Android or app. Yeah, the one everybody has. And then yeah, it's an amazing tool. So um thank you so much, Rachel, for being with us today. I truly appreciate all of the pearls of wisdom
Yeah.
that you've dropped. Thank you for treating HS patients. Thank you for treating us so kindly,
Yeah.
and really taking the time to explain. Another thing is, if you guys have the opportunity to see like a PA or a nurse practitioner, take the opportunity to do that. They tend to have more time to spend with us. Versus an actual, like an MD, who is just, they have an average of 7 minutes to see a patient, and that's not their fault. The system has been built that way.
Right.
Unfortunately, they would love to spend more time with us, but they don't have that time to spend. So if you do have an opportunity to see a physician's assistant or a nurse practitioner, take those opportunities, because you get a lot more one-on-one time with those providers. So I think it's a great opportunity, especially for new patients too, coming into HS or anything like that. So thank you again so much for being with us. We really appreciate your time, and hopefully we'll have you back on another episode.
Thank you guys so much. I really appreciate it. And thank you so much for the work that you do and, bringing this condition to light and, helping patients kind of navigate this. And, I'm partial to nurse practitioners and what we call mid-level providers, PAs and Ps. And so, just mentioning that is huge. And so I really appreciate you guys.
Yeah. Thank you so much. Appreciate you.